Hello friends, welcome back to my channel. Today I am going to discuss with you regarding Glasgow Coma scale, that is also called GCS. And GCS is used to objectively describe the extent of impaired consciousness in all type of acute medical and trauma patient. It is a scale used for assess the level of consciousness. It is a scale that assessing neurological condition of the client. So it is mainly used for the neurological patients to assess the level of consciousness of the patient. And in this, three components are there to assess the patient conscious level, that is eye, verbal and motor. That is also called EVM. E for eye opening response, V for verbal response and M for motor response. So these are the three aspects of responsiveness. Well, next, the scoring system is based on a scale of 1 to 15 points. That is, total score for GCS is 15. That is maximum score, and 1 is the minimum score. So total is 1 to 15 points. Okay. The lowest possible score is, that is 3. It indicates deep coma or death clear कर देते हैं इसमें, that is 3. So next is maximum score is 15. It indicates fully healthy patient. So next is the classification of brain injury according to GCS. So mainly I have already mentioned about that it's used for neurological patients. So in brain injury we can assess the GCS of the patient. So first, in mild injury, the score will be 13 to 15 score, and in moderate injury 9 to 13 score, and in severe injury lower than 8 indicates coma. Deep coma means score 3, and minimum score is 3 and maximum score is 15. So total GCS is of 15 scores. Okay. Now I will tell you regarding the trick how to assess GCS in patient and to learn the GCS. It's easy trick like ESPN. It's a channel used cricket match. Okay. So next is our country wins. That is, after match our country win and cannot live without fans. So this is a trick used to learn the GCS. Okay. So first I will tell you regarding the eye response. So ESPN can be used like this. E for eye open spontaneously, in which the patient is spontaneously open eye without any like we can call the patient and directly patient can open his or her eyes. Next is S, that is sound. So when we speak the name of the patient, so he heard the sound and then the patient open the eyes, so that is the eye response. And next is 2, that is pain, and while putting some pain to the patient, he or she will respond the eye, that is the 2. And then the next is the 1, that is not opening even pain, so there is no any response, then we can give 1 score. So total score for eye is 4, that is 4, 3, 2 and 1. 4 when patient spontaneously open the eye, 3 is to the sound, 2 is to the pain and 1 is not opening even after pain also. Okay. So well, next second component is verbal response, and we can use the trick our country win. So R O is oriented, so 5 score for that. Then is country, C confused, that is 4. In oriented we can check the patient conscious level like the place, person and time patient is oriented or not towards that. Next is score 4, when the patient is confused, patient is responding to a question but he is in confused stage. Next is score 3, when the words are inappropriate. So win, WIN, W means words, words inappropriate. Patient is responding to us like that, but in this condition the patient's words are not proper. Then the 2 score is given when incomprehensive sounds are there. Patient responding very little bit, only saying like speak small words, small incomprehensive sounds. Okay, next one is score 1 when there is no response to the towards patient. Okay, so WIN. Okay, N means no response. So this is overall verbal response. Next is motor response. The third component of GCS is motor response. We can use trick cannot live without fan. Cannot C is for the command obey. So in this we can give 6 score for that. When the patient is responding to our commands, like when we ask the patient to pick up his hand or arm, the patient is doing same way. That means the patient is commanding towards us. Okay, next is 5 scores when patient respond towards localized to pain. So live ka L is for localized. Then is without. W is for withdraw to pain. So when we pinch the patient, he or she can withdraw towards away. So that means 4 score is given towards 4 score given to that time. Okay, next is 3 when there is flexion, that is also called decorticate. When the patient body is stiff but patient is body is stiff and patient is flexing his or her body. Okay, next is score 2, that is abnormal extension. It is also called decerebrate. When the patient in this condition, the patient's body is fully stiff but the arms are outward from his body. Okay, next is 1, that is no response. So here F for flexion, A for abnormal extension, and N for no response. So we can use this trick so that we can easily learn the GCS. Once again I will tell you the trick, that is ESPN. Our country win, then cannot live without fan. So E means now only I have tell you like patient is E means eye open spontaneously. S means patient is give a sound to the patient. Then is when patient we give pain to the patient, and the last one is not opening even against the pain. Okay, so last motor response, verbal response is second component. Our country win. O for patient is oriented. And next is C when the patient is confused. And then is W when patient is speak words only. And I for incomprehensive sounds. And N for no response. Then cannot live without fan. C for command obey. Then next is L for localized to pain, W means withdraw to pain, F means flexion, A for abnormal extension, and N for no response. So this is the trick. So guys, I hope you have understand this. If you have any query, please do comment me. I will answer you. Thank you for watching my video.